All right, so preparation is very important as a nurse, not only as a nurse, but in every aspect of our life, our daily life, whether or not you're a nurse, teacher. Preparation is very important. Years ago when I was working in the emergency room back in my country, I had a patient who came in on a van, and I was in triage, the secondary triage area in that department. And I tell you, the patient came in, I tell you, say everybody in the department run. But anyways, even though persons were moving away, I had to triage that patient, I had to find out what was happening. But that patient had a black scandal bag over the foot, and the only thing we could hear was zzz, zzz, because there were flies. So, anyways, we did that, take care of that situation, and it was a done deal. Life went on. Then I moved here to the state. Every time I am going in for a code blue, especially when I hear that the ambulance is, coming in with that patient, I am always prepared because of past experience. And past experience has, taught me the importance of preparation as a nurse. Because, especially in this first world country where resources are so much available, I am not going to be going into a code blue and not be wearing certain gears. I'm going in there with my gown on, I'm going in with my mask on, my gloves on, and my face shield or eye shield sometimes. So a lot of times persons would see me and they were like, okay, then I guess we have a code blue coming in, or we have a code blue or something like that, cardiac arrest. And I'm like, yeah, definitely me. You understand? So they'll always be laughing. But one thing they don't understand is that you don't know what is coming in, because sometimes persons might tell you, you might get a report that this is what the situation looks like, or this is what the situation is. But then when the patient does arrive, it is something totally different. So for me, it's always better to be prepared than sorry, because a lot of times I've seen nurses working in the same code blue, the CPR, and they are so bloody. They have vomit all over them. You understand? And they are doing something like, trying to step back while they're trying to put in an NG tube or a catheter. And because of the lack of preparation as a nurse, you find yourself doing that. I'm up close and personal to, the point where I can do certain things comfortably because I am wearing my plastic gown and I'm wearing my eyewear, I'm wearing my face shield because I'm prepared for, the what ifs. And so as a nurse practitioner, it's the same thing. It's the same thing. A lot of times we might go out there and we have our stethoscope around our neck and we go in and we're like, okay, then yes, I'm ready for this. But the concern that the patient call about is totally different from what you're going there to see. And so sometimes because of me preparing myself for the worst, I tend to find myself not having that much of a big problem sometimes, because if I go in and I see where this is what is happening, me I go step back. Just like the other day when I saw a patient, and I tell you, I wasn't expecting it, but I literally just stepped back out of the person's house, back onto the patio, down onto the grass, and then started asking the patient to come out so we can talk to the patient. At that time when I was seeing the patient, it warranted me to stay on the grass, because as I said, sometimes these patients will come and they will say, this is what is happening. But if you are a critical thinker as a nurse, you will be able to say that the patient scratching like this non-stop, and you're seeing scratch mark all over, if you're seeing dog hair on the floor, if you're seeing a big dog in the place and everything is like, so cluttered, then you are there with your mind, thinking what is going on. And if you're the smart person, then you're going to excuse yourself from that environment because you don't want to take home any insect. You don't want to take home anything with you that doesn't belong on you. Critical thinking in nursing saves the patient, and sometimes it saves us as nurses, because when we're able to identify, put the pieces together, it will work out in our favor. Because imagine if I had, been there and just been trying to please this patient, telling the patient that, yes, I am here and this is what is going on, and I'm going to be just writing the order, doing my assessment, and ignoring the fact that the patient is scratching nonstop, then there's a high possibility that today I might have had scabies, I might have had bed bugs, I might have had lice, because those are the things, the red flags that are, going off for me at that time. So critical thinking as a nurse is very, very good. It is a very good attribute that every nurse should have, because it will save you, it will save your patient, and it will save your license as well. It will save your license as well. So definitely remember that critical thinking is key when it comes down to nursing inside the hospital as well as outside of the hospital. And that's all I'm going to leave on that. So until then, I will see you in the next video. But go ahead and remember to follow me here on TikTok at Think Nursing 1, YouTube page at Think Nursing. Be a part of the channel, where I share information regarding my exercise routine. I do share a little podcast where I interview persons. I do talk about nursing, travel, lifestyle, just about everything. Your support means a lot to me, and I just want to say thank you for doing that in advance. Until then, I will see you in the next video. All right, bye.